Hello. For those of you that don't know me, my name is Dave Kent, and I'm the nursing leader who is responsible for initiating the role of the colorectal nurse navigator. Today I will be walking you through a refresher course for the expectations associated with this population of people. If you don't remember anything about my presentation today, please know that there are 3 things I want you to take away from this. I want you to understand the primary population this disease affects, the primary side effects that you would see in this population of people, and third, the key to treatment. I will review these topics again in detail for thorough understanding. Here are the goals of my presentation in SMART format. S means specific, M stands for measurable goals, A is attainable, R stands for results, and T is time frame. The specifics of colorectal cancer is that it commonly occurs in persons greater than 50 years of age. M. At the conclusion of this presentation, the audience should be able to answer the goals associated with this presentation. A. The reviews that we have are attainable and realistic and will be covered in detail. R. The results will make clinicians more aware of signs and symptoms associated with colorectal cancer. T. By the time the presentation concludes, the learner will be able to verbalize the population affected, the most common side effects, and the keys to treatment. Risk factors. Age is the greatest risk factor for developing colorectal cancer. People with a family history or people with close relatives who have had colorectal cancer are also at a greater risk for disease prevalence. People with a family history should follow up with their physician about the more frequent screenings. Diet. Consuming a high-fat diet, including large amounts of red and processed meats, can also increase the risk. Health. Overweight people are at a higher risk for developing colorectal cancer. Type 2 diabetes has also been linked with increased risk of colorectal cancer. People who have a family history of polyps are also at an increased risk. Development of a multidisciplinary, patient-focused treatment plan is necessary with this population, as it often takes several different treatments to treat the patient properly. The 4 major treatments for colorectal cancer is surgery, chemotherapy, radiation therapy, and specific targeted therapy. Surgery is the most common treatment for most early stages of colorectal cancer. The goal of the treatment is the removal of the tumor and some of the surrounding healthy tissues and/or lymph nodes to treat the cancer and prevent the spread to other tissues. Chemotherapy is the use of drugs to destroy cancer cells. Chemotherapy is a systemic treatment plan that can go into the bloodstream and also kill other healthy cells and impact the patient's overall health during treatment. The goal of this treatment is to kill cells and prevent them from dividing. Radiation therapy is the use of high-energy X-rays to destroy cancer cells. Radiation therapy is commonly used for treating colorectal cancer because this tumor tends to recur where it originated from. Targeted therapy is the treatment of the cancer's specific genes, proteins, or tissue environment that contributes to the cancer growth and survival. The goal of this treatment is to prevent the cancer from growing. With all of the prevalence of colorectal cancer and it being in the top 3 cancers for cancer-related death, the varying different treatments need a nurse navigator to help traverse some of the treatment plan effectively and to increase compliance and decrease adverse outcomes. The key to colorectal cancer is prevention and early detection. Early detection is the key to success. By having routine colonoscopies after the age of 50, it will prevent disease progression and improve outcomes. Maintaining a healthy weight has also been proven to help provide a healthy lifestyle and decrease occurrence of colorectal cancer. Commitment to an active life that is healthy by regularly exercising can also help people decrease obesity and therefore offset the chances of colorectal cancer. Eating a balanced diet is very important. Decreasing the amount of processed food and red meat consumed will also help reduce risk. Fat found in these foods stimulates bile acids and can act as a carcinogen to the colonic mucosa. Controlling your diabetes. People with type 2 diabetes have an increased risk due to increased sugars in the body and can cause excessive growth related to this. Diabetic people should be treated as an individual with increased risk and monitored more frequently. Smoking and alcohol have also been reported to increase the relative risk for an individual to develop colorectal cancer. As you can see from the provided picture, the size of the tumor is used to determine the stage and size of the tumor. The smaller polyps are benign, and as they grow, the cell division changes and causes them to become more malignant. Small polyps that are seen during colonoscopy can be snipped and treated, and therefore they are taken care of before they become malignant. The treatment of these polyps during colonoscopy are as important as it can negate the problem before it occurs and also give the patient a chance to make changes to their lifestyle and prevent recurrence. The malignancies that happen in polyps occur in the rectum and large intestines. The malignancies are caused by gene mutations that happen as the polyp grows and also by frequent exposure to carcinogens. These carcinogens vary but are equally as deadly. Typically, people in the early stages of colorectal cancer do not have symptoms. Symptoms become more apparent as the disease progresses. Signs and symptoms: abnormal or change in bowel habits, vomiting, diarrhea, or constipation, bleeding from the rectum or blood in the stool, unexpected weight loss, feeling that the bowel does not empty, cramping or stomach discomfort. All of these signs and symptoms are relevant to colorectal cancer and are a sign that you should see your general practitioner. Diagnostic treatments always start with a thorough medical exam with a primary care physician to determine if further testing is necessary. Blood tests are typically ordered by the physician and include a CBC, complete blood count, a chemistry check to see if liver enzymes are within specified limits, and then specialty tests to determine tumor markers. A CBC is ordered to check for anemia, as anemia is a typical side effect associated with colorectal cancer. Fecal occult blood testing is the testing of the stool for the presence of blood. This test tells us if there is blood occurring in the colon. Fecal DNA testing is another test that is done. It is used as a screening tool that tests DNA markers in the stool for diagnosis. If further testing is necessary, then a colonoscopy would be ordered. Colonoscopies are the most successful diagnostic tool for identifying and removing polyps before they become neoplasms. Pharmacologic therapy. The most commonly used drug combination to treat colorectal cancer is the FOLFOX combination. FUL, F-U-L, comes from the leucovorin calcium, which is also known as folinic acid. F is the fluorouracil, we call it 5-FU, and then the OX is the oxaliplatin. Together, it forms FOLFOX, in short, is the name of the regimen. Non-pharmacologic therapies include integrative therapies such as massage, yoga, and healing touch. The purpose of massage is to loosen sore muscles that may be contracted due to tumor. Yoga is a good alternative medicine because it encourages physical exercise and helps people maintain healthy living. Healing touch is an integrative therapy that can be focused on relieving ailments through channeled energy. By pushing on receptors such as the feet, for example, it can relieve pain in the abdomen. While there are many different non-pharmacologic therapies, these treatments should be cleared with a physician to clear that they are not going to cause further pain or injury to the patient. We here at DRHA treat healthcare in a collaborative manner. We use multidisciplinary care as our standard to achieve optimal outcomes. Nursing Navigator positions will help streamline this multidisciplinary care to help focus on populations with poor outcomes historically. DRHA has multiple different disciplines available for patients to access when they have questions or concerns about their care or their lifestyle outside of the hospital. We need to use these professionals more openly and look for the underlying patient knowledge deficiencies during their stay, opposed to asking them if they would like to speak to a nutritionist, for example. Patients might be open to talking, but they will rarely ask for help. Seeking medical care regularly and having checkups are important parts of optimal health. The survival rates on colorectal cancer are improving, but in order for the disease to be eradicated, it starts with regular screening. Screening and early diagnosis of colorectal cancer are important to the long-term survivability of the disease. The goals of this presentation were to teach you the following: understanding the primary population of this disease affects. The primary population that this disease affects is adults greater than 50 years of age. The next goal was to identify the primary side effects you would see in this population. Early stages of the disease may not have symptoms, but the disease can commonly affect the bowel and cause blood to be in the stool. That is one of the common side effects you would see in this population. Most commonly, it will start with blood in the stool. The key to treatment. The key to treatment is early diagnosis. Higher success of treatment and life have been shown to improve dramatically when diagnosed early. I have also included a fast fact sheet for your review. I will be available for the next few minutes to answer any questions that you have, but I have also included my contact information to get a hold of me in case there are any questions that come up. Thank you and have a great day. The following are the references used in this presentation.